Hi, I'm Amber Dr. Enright, and I came in to see Dr. David George after a really traumatic car accident. Right after my car accident, I had this completely overwhelming emotional response to everything. Picking cars, driving, my tasks, my calendar, text messages. I didn't realize this emotional overwhelm was part of what's called acute stress disorder. Think of like the things that can lead into PTSD. So when I heard that, I knew immediately that the things that are going on my insides, things that are going on for my emotional care are just as important for me to rehab as the things that are going on the outside. So I'm undergoing today something called a stellate ganglion block. I actually have had one before and it was incredibly helpful. It's probably the reason I can talk right now without completely breaking down. And so I'm having another one, and I can't wait for you to see what it is. So this procedure is really unusual. My head is turned to the side and my neck is exposed on the left. And the doctor is actually going to use a needle and go into right around a nerve that passes out of my neck. This treatment is going to help me with my mental clarity, my emotions, these feelings of overwhelm. All of that helps me make better decisions for myself and be able to manage day-to-day tasks that otherwise feel like, even chores can feel like it's just too much. Okay, so one of the very first things you're gonna notice about this office is it's incredibly relaxing. Last time I was in here, it felt like I was like in a peaceful jungle. It doesn't feel like when I'm really nervous to go to the doctor's office usually. I think that's really important because I've just been feeling so emotionally overwhelmed. The last thing you want is like to go sit on a cold chair and have someone examine you. I also have a needle phobia. So this is saying a lot that I'd let somebody poke me in the neck with a needle to find some kind of relief.
Okay, so what we're doing right now is we're just giving Amber just a little bit of gas just to make her a little bit more comfortable. Even though she's doing the gas, she's gonna be awake the whole time. It's just there to take away the anxiety a little bit and just keep it comfortable. So the whole time, Amber's gonna be able to talk. We might talk, but it's very comfortable.
So because I have a needle phobia, the first part is the hardest, when he's gonna actually poke me with the needle. After that, seeing the screen actually brought me relief because I know what he's looking for and looking at because he describes it while he's doing the procedure.
Everything that we do in this procedure is done under ultrasound guidance. So what that means is everything's visible. We can see it all on the screen that we're doing. Keeps the procedure very precise and very accurate and safe. All right, Amber, we're in that moment of time, okay?
I need 5 more seconds.
Take your time.
Don't poke me yet.
We're not gonna poke. I told you,
Okay.
Nothing happens before I tell you. Okay?
Show me where you're gonna go.
You see the little shark fin right there?
Sharks.
You see the shark?
Yeah. I see the shark fin right here. Boop.
That's the one. That's C6, and just above is your scalene, and your longus coeli is just in front of that. If you're ready, I'm ready.
Okay.
You ready?
I'm ready.
Okay. Pinch.
With the sympathetic nervous system, or what happens after trauma, why does this help? What does it do?
So we're still learning about how this works, but what we do know is that trauma obviously ramps up your fight or flight nervous system. It's there for a reason. One of the things that does, particularly in PTSD, like you had after your car wreck, it puts you in this chronic stress state, which puts a lot of glucose into your bloodstream. And the way it works on your nervous system is it's almost as if it kind of seeps into every function in your nervous system, tainting it with negativity. So you have a negative bias in thinking, you're kind of wound up, you have anxiety, it's difficult to sleep.
Things are gonna harm me.
Exactly. So it's kind of it's telling your nervous system this threat, which leads you to be what we call hypervigilant, looking for a reason for that threat. You're always on edge. So by shutting down that sympathetic nervous system, it seems like the brain takes that moment to do a little reset, and it just kind of gets back to stable.
What are some of the symptoms that I can expect after this procedure?
So remember, this is an anesthetic, just like when you go to the dentist. You could have a droopy eye, it could affect how you kind of focus in that eye. And just like when you go to the dentist, these symptoms are transient. They go away when the anesthetic wears off. You can have a sense of a little congestion in your nose.
I do.
Yeah, you have that feeling right now? Well, these are all encouraging.
Only on the left. Right, my sinus.
Right. So that's it. But overwhelmingly, the majority of people start noticing the positive things, that this kind of feel a wave of relaxation. Their thought becomes clear. And then as it progresses over days after that, sleep is better, calm, these sorts of things. Okay, we're done.
Nice.
That's it.
Ooh, I'm so glad.
Just as simple as that. So now what we're going to do is Amber's just going to be relaxing for a little while. How do you feel?
Perfect.
Okay.
It was just a little poke. So after the procedure, he kind of watches for some things that make sure that the procedure is effective. It has essentially almost immediate effects on my nervous system, which helps me stay calm, make good decisions, not feel overwhelmed. And all those things actually impact things like how I get ready in the morning. I can leave the house and do my makeup. These things are really important when you've just gone through something really traumatic. That's essentially changing things about your daily life, your relationships, and your work. I already feel relief just from knowing that that's going to kick in a little bit.
So having just completed the injection, we're going to have Amber lie here for about 5 minutes. What we're doing is we're watching her blood pressure and her pulse on the screen right now. It looks wonderful. What we should see is as we're shutting down the sympathetic nervous system on this side, we'll start seeing changes that tell us that the sympathetic nervous system, the fight or flight nervous system, is winding down. One of those clues is that we'll see a change in the pupil. We'll see a little droopy eyelid, a change in the pupil size, and we'll see a temperature change from side to side.
Yeah, so if anybody says I have a lazy eye today.
Okay, so we're starting to see a pretty significant change in temperature from side to side, which is telling us that the sympathetic nervous system is winding down. So by all accounts at this point, this looks like a successful procedure. So she's just going to relax for 5 minutes on the table, and then we'll take her back to relax in one of the rooms in the back.
So now I'm in the recovery area. I'm watching the sunrise, which is really nice. And I'm actually just feeling really calm, really relaxed, and ready for a nap. So after the procedure, I will stay here for like 30 to 60 minutes, and Dr. David's gonna come and check on me. If I can fall asleep, great. And then when I wake up, he's gonna check all the same things that he was checking before, making sure that I'm feeling well, I don't have any post-operative or post-procedural symptoms. And since I already had this before, I really like this part because it's the part where I know that I can now nap when I go home and relax. And I don't have to be worried because I already knew what this was like before. After the procedure, it's really normal to feel like some congestion over here. So this is the side I was treated on. And it really just feels kind of like I have a little sinus cold. My voice can change a little. It's more relaxed on this side, meaning like my voice box is actually, the muscles are relaxed. So you might notice just a little bit of like hoarseness, or like your voice has dropped just a tiny bit. And sometimes you can also feel like you need to swallow. That's kind of an unusual, I guess, way to describe it. And then in my eyes, you might notice that my left eyelid is a little droopy. That's really normal after this procedure. My whole nervous system is saying, calm down, go to sleep. So this is actually totally normal. And then my pupil size will not be the same left to right. This is one of the first things that the doctor will look at to make sure that their procedure is effective. And this can last a few hours, and then that part will go away when the anesthetic is gone. The impacts of this will continue to last though. This is not something that I still feel the impact of the last one that I had about a week ago from the right side. Again, for me, that means I'm gonna be able to sleep really well tonight. I'm not gonna be spinning in my mind with worry. It means that I can make better decisions because I can compare things and I can focus on my work. This is a big deal. My brain needed this, my body needed this so it can actually relax. And again, I cannot believe that I didn't know that the emotional aspect of this was so heavy after an accident like this. So if you're suffering from PTSD, you need a really skilled provider. This Stellate Ganglion Block has been absolutely a game changer for me. And I'm not sure how long my recovery would have taken if somebody had not at least thought to address the emotional aspects of this. So I just want to say thank you, Dr. David George. This has been
absolutely relieving. Thank you. There we go. And that was Dr. David George's office at Neuregen. I feel great. That was a super simple procedure. And I'm Dr. Amber Enright with Scottsdale Top Docs and the Therapy Doctor. I really hope this helps you find the resources that you need.